Namaste, ladies and gentlemen, and welcome to our live session on robotic joint replacement surgery. I'm your host, Dr. Sushila, and we will be sharing insights on this cutting edge surgical technique with you today. Before we begin, let me introduce our esteemed guest, a Padma Shri awardee, Dr. Yash Gulati, senior consultant orthopedic surgeon with extensive experience in robotic joint replacement surgery. Welcome to the podcast, Dr. Gulati.
Thank you
Wonderful.
very much.
Wonderful. Now that we are all set, sir, let's dive right into our discussion on robotic joint replacement surgery. To start off, let's provide our audience with an overview of what robotic joint replacement surgery entails. Could you please explain the basics of this surgical technique, sir?
Okay, see, when we do joint replacement, we what happens is that when joint gets destroyed for whatever reason, whether it is age related or whether it is due to disease like rheumatoid arthritis, we need to reproduce the anatomy of that joint. So we put an artificial, it's a resurfacing, it's really not a replacement. So we put the implant on top of that. So the alignment should be such, the placement should be such, the sizing should be such that it can replicate the original anatomy of the patient. Now, what happens is that with conventional instrumentation, we have been doing that for the last 30 years with extremely successful results. But some 15 to 20% of patients had some unhappiness about it. So, research was done as to why that was happening. It was discovered that even 2 to 3 degrees of malalignment, which is possible, can cause this kind of a problem. So, then research went into that how to correct that. Then it was discovered that if we can have the patient's own data, patient's own anatomy recorded before the surgery, say on a CT scan, and we reformat that image, make a model, digital model of the patient on the screen, and then try to replicate putting the joint in that particular anatomy, the results are going to be much better. So that was the basis of robotic surgery. So what we do is we do a CT scan of the patient before the surgery. We thousands of cuts in that, and then a digital model is created, and that tells us where to place that implant, what is the size of implant going to be, and what is the angle that's going to be. The robot gives us an idea what to do. Then we have that on the screen in the operation theater, and when we are live doing the surgery on the patient, we are able to see what the patient's data shows and what the CT was showing, and then we take into consideration the patient's laxity of the ligaments. Then that is coupled on the screen in the operation theater, and we are able to dial in how much cut to make, where to go, how much to go, and this results in a much less cutting of the bone, much less handling of the soft tissue, and much more precise placement of the implant, and that gives a very good function. And very early, maybe I have a model I show you like this. See, this is how an implant is put on the bone. Now if this implant can be put in a proper alignment, not like this, but exactly the way it should be in every patient. Just remember, all human beings are different. Like our fingerprints are different, our angles from hip, knee to ankle is different in everybody. So what was being done earlier was that we were taking average of that and we were putting on that angle. But now with the robot, it is possible to put precisely on the same angle that is for that particular patient.
Yeah.
So this is a game changer. And also, once we have done that, the robot will not let you go wrong. It will let you go exactly the way it is planned. So that is the basis. The precision, less cutting of bone, less soft tissue handling, and doing exactly what has been planned and rehearsed before the surgery and even during the surgery.
Right. Right. So a lot of customization is offered to the patient in terms of the outcomes. So that's what I gather from and thank you for a very concise explanation about it. Let's move on to the next segment, sir. What are the benefits and advancements that have happened in robotic joint replacement surgery?
But this is the cutting edge technology. This is the best that is offered anywhere in the world, and we are offering exactly the same surgery that would be done anywhere in the US or in some European countries, and that too in very limited number of centers. It's not available in all the hospitals in even in advanced countries. So we would be amongst very few places in the world which is offering this kind of surgery, and because this is advanced, because it is planned before, because it is put in precisely, because the soft tissue handling is less, and because the bone removed is less, the rehabilitation is much quicker, the chances of having problem are much quicker, and the chances of the joint lasting much more is also very high. So this is what this I would say it's a game changer. And I have a feeling that in the next 15 to 20 years, all joints will be done by robot only. There will be nothing called non-robotic joint replacement surgery.
So, sir, if you look at the traditional approaches, if you could just enumerate what are the advantages over the traditional approach vis-a-vis the robotic approach?
Traditional approaches, I personally have been doing joint replacement for 30 years, and my patients will vouch, and the literature will vouch. The results have been excellent. There have been people who were wheelchair bound, bed bound, and they are now walking normally. There have been people who were in extreme pain and they are now living pain free. But the thing is, do we want to now achieve excellence, almost perfection? See, we for example, when in my younger days we had two cars in society in our country, Fiat and Ambassador. So if we were satisfied only with that, we would be still moving in that. But now we move in better cars, better safety patterns, better mileage, better everything. So this is what it is. Those cars also took us everywhere. So now the facility, the technology is now going to give us even better results. The joints are going to last even longer. The function of the patient is going to be even better. So there's always we are in a pursuit of excellence, and this is not a baby step. This is a giant leap in getting to that particular goal to achieve as good a joint as patient's own joint was before. And ultimate aim would be that if you do joint replacement once, it should last the lifetime. We are not there yet, but this is a big step in that direction.
Thank you for sharing that, sir. It's incredible to witness how technology is continuously pushing the boundaries of medical innovation. Um, what are the common concerns and misconceptions about robotic joint replacement surgery?
I think the commonest concern would be the cost, because the cost of the robot it varies from about 5 6 crores to about 8 crores, depending on the number of softwares which are put in that and how many joints we want to do with that. So that is a major concern right now. But as we have seen with other technologies, as the use increases, as more people start using, as more companies start making these machines, they'll become cheaper. So this is the biggest concern. If cost is not a concern, I now feel that there is no question why we should not be using a robotic joint rather than a conventional joint. Right now, patient has to pay about 75,000 rupees more for one joint if he or she opts to get done with the robot, and about 1 lakh for both the joint. I mean, my take on this is, I have been doing a lot of navigation based surgery before that. Over 1,000 we have done, and the extra cost used to be about 40,000. And I did not come across a single patient who said, "Don't do that because I'm going to have to spend another 40,000." Because you have to do this surgery once in life, hopefully never again. So this amount of money is really nothing if you can achieve excellence and if you can achieve longevity of the implant. But of course, the cheaper it can become, the better. This is the biggest concern. The other concern is that it makes a lot of noise inside when you're making, but that's not a big deal. And learning curve. People have to understand that this is a different philosophy, and for a surgeon to learn it properly takes time. So they have to study on the cadaver, they have to attend workshops, they have to be certified before they are allowed to do the surgery. But that again, anything in medicine, there is a learning curve, and we have to learn and do it. And apart from that, I don't really see any major concern. I think finance is the biggest concern, but again, that, as I said, is not a very big concern considering the benefits that we can offer.
Great, sir. Great. So, moving on, sir, another important factor that I would like you to touch upon. Are there any other recent advancements or developments in this field that we should be aware of and which would be of great benefit to patients?
Yes, there are very big advancement. You can say something which was there before and went out of vogue, and then it is back now again, is the partial knee replacement. See, our joints, it is my perception, and it is the figure given not only by me but also in other countries like UK, that about 40% of patients who get the whole knee joint replacement do not need whole knee joint replacement. They only need that part of the knee replaced which is affected. And especially in our country, our legs get bowed like this, and only the inner part of the joint is affected. In those cases, we only need to change just that small part of the joint, and we don't need to change the whole joint. It's like if your door is broken, you don't have to break the wall. You just have to mend that. That's what it is. But there are some strict criteria which patient requires a partial knee, which patient will not be happy or get good result with partial knee. So those criteria, of course, have to be met, and the final decision is always on the table. Even if we say we are going to do partial, we say, well, if we find rest of the joint is not good when we look inside, we'll do totally. But that's only about in 5 or 10% of cases like that. There are radiological criteria, clinical criteria by which in about 95% of cases we say partial and it ends up being partial. And the results of partial knee or what people say half knee replacement is that the function of the patient is almost replicated. You can sit cross legged, you can play tennis, you can play light sport, you can run, you can jog, you can sit on the floor, and all these things are the gait is almost normal. And another good thing that even partial knee can be done by a robot, and that improves it even further. So these advances are very exciting. We are living in a very exciting time. All these great innovations are happening, and patients are getting benefited out of that. And it's a great time to be for the patient as well as for the doctor to be, in.
Right, right. So, collaboration between the surgeon and technology is key to ensuring great outcomes for our patients as we go
Exactly.
forward.
I mean, now with artificial intelligence coming in, with the robotics coming in, and all these things, these things are game changers. It's really happening. What I saw as a student when I did my masters, and what we do now, it is almost unimaginable that we never thought we'll reach here in my lifetime, but there we are.
That's great, sir. So, before we wrap up, would you have any final thoughts or key takeaways you'd like to share with our audience regarding robotic joint replacement surgery?
I think the most important point actually I would want to share is that get joint replacement done only when it is absolutely necessary. And that is very important. You see, if we do a joint replacement when we can do without it, the results are not good. So, joint replacement is done and should be done only when the joint has reached an end stage status. You have pain, you need painkillers, your mobility is restricted, and sometimes your sleep is disturbed. Only then. You see, never do joint replacement, and patients should never get joint replacement when they can do without it and their mobility is not that bad. They maybe need only say one painkiller a week. That's not the patient for joint replacement. When joint replacement is required, then we have to decide, for example, knee replacement. Can we do with only partial or half knee? Do we need to change the whole knee? Then once that question is answered, then do I get a robotic surgery done? My answer is emphatic yes. we should do robotic surgery if the hospital has the facility, if finance is not a big concern. And I think when you are spending, say, 6 lakhs for two knees or 5 lakhs for two knees, then spending another 75,000 is not a big deal, should not be a big deal for an operation which is a once in lifetime operation, hopefully. So that these factors should be taken into consideration. Of course, you have to see your surgeon's experience in robotic surgery, and all these things. And I can assure my audience that using robotic surgery for joint replacement is actually a game changer. Very little bone is removed compared to non-robotic surgery. Very little soft tissue surgery, soft tissue handling is required. The positioning of the implant is exactly where we want to be. We can play around, we can change the position one way or in six directions of motion to get exactly the balance that we require. So it's really a game changer, and it's really very, very beneficial for the patient. I would recommend that if people can afford it, which I think they should be able to. Unfortunately, some of the insurance companies are not covering it. I would request them that in the long run, it will be better even for insurance companies, because if the joints are going to last longer, the patient is not going to claim again for a redo surgery. So really, this should be across the board. I think everybody should be very happy to get a robotic surgery if it is required.
Yes. Thank you, Dr. Gulati, for your valuable insights and expertise throughout this session. We greatly appreciate your time. And so, this is your host, Dr. Sushila, signing off, and we'll be back with another session with another expert very soon.
Thank
Thank
you,
you
Dr.
so much.
Sushila, and all the best to all my patients. Thank you.